Good morning and welcome. You're listening live to Heart-to-Heart, a program which aims to help you understand and to become your loving self. I'm Dr. Mitra Rashidian. I'm a licensed marriage and family therapist and a certified sexologist with a private practice in beautiful Encino, California. Today, I'm going to be presenting this program to you by myself about codependency, trauma, addictions, and impacting relationships. My best friend, business partner, and colleague, Dr. Robert Jaffe, is taking a day off, and he's not going to be here, but we look forward to having him back the following week. Dr. Robert Jaffe himself is also a licensed marriage and family therapist and a certified hypnotherapist. And if he was here, he would have said that we are dedicating this program to you, the listeners and the viewers, and want to let you know that you contain within you everything you need to feel happy, joyous, and free. We are born into the world as our loving, authentic, true self, which is open, calm, curious, emotionally available, connected, honest, confident, compassionate, sexual, and trusting. So uh, please call us 951-922-3532. You can also visit us at heart-2-heart.online/YouTube. And we have some downloads for you for free that you can look at them and take a look at our prior programs and give us your feedback. We would really appreciate that. And also, please recommend this program to those that you believe they can benefit from it. Dr. Robert Jaffe, talks about codependency, and on his behalf, I have selected, a topic, an aspect of codependency from the book of Codependence, Healing the Human Condition by Dr. Whitfield. I'm looking at the process of basically, how the wounding begins, that we grow up as codependent without even knowing how that process is guiding us. Because I think once we have a better understanding of how codependency happens and why we are not able to recognize it, and we have a life full of codependent, attitude, mentality, behaviors, everything that comes with it. So the more we educate ourselves about this concept, the more we are able to monitor our behavior, monitor our attitude, catch ourselves, so that we don't act from codependent perspective. And there are actually a few stages to recover from codependency, and I will do my very best to get to those points today. But they are basically, we're looking at stage 1 recovery, which is, it's a recovery, the physical aspect of it. Then stage 2 is the mental and emotional aspect of it. And finally, the stage 3 is the spiritual aspect of recovering from codependency. So to do that, but we need to be, make ourselves aware of, educate ourselves about the, how this process, like I mentioned, that is happening. So we saw that as a spark of consciousness, of love, and innocent child of God. That's how we are stepping into this world. That's why Dr. Jaffe talks about all those qualities, beautiful qualities that we have upon birth. And then we separate from that source and forget our identity as being, part of the divine. Once we are stepping into this world, we are exposed to environmental factors. We are exposed to so many other concepts that we no longer are that divine, person that we were before birth. And why is that? Because we are born into a family and a society of wounded and unrecovered adult children, where our healthy needs are not met. I mean, and their health, also their healthy needs have not been met. So when our parents are codependent themselves and they don't know that, so here's what happens. We as children, fearing abandonment by our parents or other important relationships, we begin to internalize their projected pain and inadequacies. And that's one of the painful painful facts that children do not want to look at, do not want to accept, do not want to even pay attention to, because we are so dependent on our parents that we see them as God, and how dare for us to, believe that they may have some inadequacies as our parents, right? So we continually experience their invalidation of our uniqueness and our inner life and incorporate it as, basically it is toxic, it is unnecessary, and it is traumatic. What we develop is shame. So because of this, overwhelming pain, our true self goes into hiding. As a result, we feel empty. So when parents are not aware of their codependent attitudes, when they are not aware of their inadequacies, and they have built a system for themselves to live through that system, they believe in that system because they have survived it. And therefore, they believe if they survived it, that's the right system for their children as well. So not knowing exactly how this is damaging, they give us all of their beliefs, all of their perceptions, all of their attitudes. They impose it on us as the true facts of life and how we need to live that way. And through this process, which is basically, we are not able to recognize or to accept or to even show or to talk about our true self, because we're so dependent on our parents, we develop shame that I need to be the way they want me to be, otherwise I'm going to lose my parents, I'm going to lose their love, and therefore fear of abandonment, becomes stronger, and then I become shameful about who I am, because that's not what my parents want to see or want to have or want to develop or want to accept about me. Therefore, I become what they want me to become, and then I become shameful about who I am. Wow, this is so interesting, right? Imagine that our mind as children, how we are able to process that so quickly, because we have so much fear of being abandoned. We have so much fear of losing our parents because we're so dependent on them for surviving, right? So whatever they say, we accept it without even examining it. And not to mention, at that young age, we don't have the capability or ability to understand what is right, what is wrong. The only thing we feel is the uncomfortableness. The only thing we feel is, the pain that something's not right about me. But we are too naive to even, bring it up because we even don't know how, right? While at some level, we may sense that something is wrong, that's what I just talked about, and that we are in an unhealthy family, we know that there is a little we can do about it, right? If we face up to the fact the pain and confusion might be too overwhelming. True, that's true. And then to survive, we internalize the projected painful messages that we are inadequate and bad, and that our parents and others are adequate and good. And therefore, we idealize our parents and other authority figures, right? Yeah. But we do that because our life depends on them, our surviving depends on them. We are not able to provide for ourselves. We are not able to take care of ourselves. We are not even able to feed ourselves to a degree. And we need somebody to put us to bed, and we need somebody to pamper us. We need somebody to take care of us. Therefore, we accept their terms versus what I feel about myself. And therefore, during this process, we neglect our healthy needs and deny our internal and external, needs for reality in order to survive. Even with continued trauma, however, our true self never dies. Exactly, because our true self is the essence of who we are. We are, through this process of becoming a dependent on our parents or caregivers, we are developing a false self version of ourselves. That doesn't mean that our true self, is gonna just go away. No, it's not gonna go away. It is within us, and as a matter of fact, it continues to grow with us. And then it struggles to come alive in all kinds of ways. Yes, because we can push back the true self, but it will show itself somewhere else. And that's why we feel empty. That's one of the reasons we feel confused. That's one of the reasons we feel unhappy. And we are always searching for that inner happiness, that ultimate happiness in life. And therefore, we try to fill our emptiness with the only way that others, model and accept, and from the outside, right? Where in fact, happiness comes from inside. It's an inner concept, but we lose the reality touch to that, and we believe that whatever is given us outside is the source of happiness. But of course, we see that this doesn't work. And then we continue to experience, an increasing unhealthy tolerance of and numbness to emotional pain. Yeah. So what do we do with all that unhappiness? We say, okay, well, I'm just going to have to numb it, right? And then the inability to feel and to grieve, coupled with distortions in our personal boundaries, may cause us to become people pleaser. So a codependent, basically the other name for it, the other terminology for it is people pleasers. And then as we grow up, guess what happens? The wound becomes deeper, the pain becomes bigger, our codependency grows, and we are more and more and more become apart from our own authentic true self. And then when we operate out of fear and shame, that means that if you're afraid important people will leave us, we learn to tolerate their inappropriate behavior to such an extent that we develop the condition associated with the core issue of high tolerance for inappropriate behavior. So that means that, we focus outside ourselves, and then to basically shape our true self. And we now have the, condition of primary codependence, a major manifestation of the adult child syndrome. And then so eventually we are on the road to become another version of our parents, right? So let's see, I think we are close to a commercial break, if I'm not mistaken. And if that's the case, yeah. So, and I was just told yes. So this is a fascinating topic, and I'm going to continue with this after our commercial break. Meanwhile, I'd like to hear from you, please. Call me at 951-922-3532. I'm sure that many of us have these experiences, and then we will continue with the discussion. See you in a short few minutes after our commercial break. Thank you. Welcome from our commercial break. Dr. Mitra and Dr. Robert here at Heart-to-Heart program at KMET 1490 AM ABC News Radio. For those of you just tuning in, our discussion for this segment is about the genesis of codependency. And of course, Dr. Robert is taking a day off. and I'm providing this information on his behalf as well. I'd like to invite you to please call us at 951-922-3532. And also you can visit us at our YouTube at heart-2-heart.online/YouTube. And please enjoy downloading some of our free handout that we have over there. And also, if you feel that this program can help somebody that you know, please let them know about what we say here and what we do. And I'm happy to receive your comments, your questions via email, which you can see all that information at our page at KMET Radio. So we were talking about how we develop codependency, and then how we become a people pleaser, and then how we operate out of fear and shame because we are afraid to lose the people that we believe are important in our lives, and therefore we don't want to lose them, so we become what they instruct us to become. And during this time, we basically, experience multiple and repeated episodes of age aggression. Suddenly, we feel small and helpless when experiencing any kind and degree of trauma. These repeated age, regression tend to reinforce our fear, shame, and confusion. And this is, when we develop the adult child syndrome, this is when this all happens. And I'm looking at the diagram here in this book, which is so fascinating, and I wish I could have, show you this diagram, because it exactly tells us how starting from birth into the family and society, where it's, where our healthy needs are not met. And then that's when we develop fear of abandonment. That's the first step. And then the next one is that how we internalize parents and others' projected inadequacies. And because we want to believe that our parents are perfect, but they actually, they're not. And it's okay that if they are not, because guess what? They grow up with parents that they also had inadequacies. They also had lack of information about what a healthy life is. And they too try to survive within that environment, right? Still, we idealize our parents to survive, and we neglect our needs, and we deny our, internal and external reality to survive. And then we basically increase tolerance of and numbness to emotional pain, that's how trauma continues, which we call them pervasive trauma, small t traumas. We are not aware of them, but we accept them and we operate based on them, and therefore we continue. So trauma is not just, car accidents or earthquake or, other, natural disasters or rape or anything like that. These continued trauma, small t trauma, they are pervasive. They haunt us all our life, and we don't even notice them. And therefore, when we want to tolerate the emotional pain, then the numbness, right, gives us the inability to feel and to grieve. And then we don't know how, therefore, to create personal boundaries. And then, but we do, generate lots of fear and toxic shame and confusion, and we begin to feel out of control, right? So the stage 0, when we get to this point, is very interesting. That's when conditions that people experience, we see that in therapy room, when they come into therapy and they are at the stage 0, usually they talk about, ongoing stress. They feel depressed. They talk about a number, at least one or a combination of addictions, compulsions. They have eating disorders. They have mental disorders. They have fear. Basically, that means they are anxious and they panic. They have relationship issues, relationship addictions, And then, they also talk about physical illnesses, and they feel out of control, and they think that all these, conditions basically are, controlling their life, which is actually true. This is how we lose our touch with our own reality, and then we're wondering why we are suffering so much. And so this is how the stage one basically take place and happens. So let's talk about the addictions part of it, the compulsions, and the, see how they manifest themselves in our lives. Eventually one or more addictions, compulsions, or other distress may appear if we are, having a life that is full of stress, full of blocked grief or depression, and full of fear, anxiety, and, basically panics. So these may include, stress-related or psychosomatic illnesses. Some people come in and they complain from muscle ache, they complain from, headache, they have chronic, migraine, they have feel tired all the time, right? And so those are psychosomatic illnesses. And then blocked grief, and which is, again, it's the same as saying depression. Unhandled fear, often called anxiety and panic disorder. Relationship addiction, which, happens commonly in more of an advanced codependent, people, and any of a variety of mental or physical disorders or disorder. So we see that, during any of these situations, we may begin to feel out of control. Because of this, we experience the need to control more, that accompanied by mood swings that may become severe, and delusion and projection of our pain onto others. So here, two factors that I like to point out. Negative emotions, basically, they only have three places to go. So into our body, psychosomatic illnesses, right? Against ourselves, addictions, and, projecting on somebody that's really close to us. That's why we have so much of a conflict among relationships, right? It doesn't mean that everything classifies under, projections, but then again, when we feel out of control because of, we experience the need to control more, right? And then when we need to control more, that means controlling each other, telling people what to do, telling people, how to be who they are, right? And of course, we experience resistance from other people, but then again, so we feel that the pain and, suffering becomes more for us. Our lives, may become chaotic. We may make, various attempts at superficial, remedies for all of the pain, which may or may not help. And ultimately, we hit bottom. It is at this point that we have the opportunity to begin to recognize and heal this entire wounding process through self-initiated and motivated experience known as recovery. So it's very interesting that, unless people hit rock bottom, they are not able to realize that how much of the controlling factor they have developed, and how much of the fear and anxiety and emotional pain they have developed as a result of their codependency, and then the trauma associated with that. This is a very sensitive topic, and there are people, when a majority of patients, clients, when they come to my office, they explain this, that these are their experiences. However, when we talk about codependency, they have such a hard time accepting that they have been a codependent. And I myself, I don't like to label anybody as codependent. What I do is I tell them life experiences have made them choose a system of survival for themselves, a system of defense mechanism, so that they can, manifest, how they can basically stay in a track of their lives. But of course, it has been combined with everyday struggle, everyday unhappiness. And for my clients to accept that, they initially learn this codependency, this attitude, these perceptions, these beliefs from their parents or caregivers, and then larger society, it's hard for them to believe. It's hard for them to accept that, oh, parents may have had something to do with this, parents that they trust, that they believe, and they never, it's very hard for them actually to accept that their parents have not been, the God version of who they thought they are. And it's hard for people to accept, my mom had faults, my dad had faults. They become so protective of them. And, that's an indication of not only love, but also sense of dependency that they continue to have towards parents and caregivers, even in adulthood. So basically that emotional cord still exists, and basically that unhealthy attachment, they still exist. So that's why all of this becomes very difficult, not only to believe, to accept, but also, how, how do they take steps to basically resolve it. But we have, the process of recovery, right? And no one knows how many people are able to use hitting the bottom, as an opportunity for recovery and life transformation. Many who hit bottom seem to experience little or no recovery. They continue living, lives in a quiet desperation, and end with often premature cancer, cardiovascular diseases, or other physical and mental diseases. And then this is, any stage 0 condition. So remember, I told you that negative emotions have only 3 places to go, right? Into ourselves, so we get sick, as we see that, how we can develop many factors. Actually, many people, research shows that those that they have diabetic type 2, is not so much about their eating habit, or about, lack of exercise. While those are obviously major contributing factors, however, the amount of stress causes, the release of massive amount of cortisol, and then that cortisol definitely combined with insulin, it can cause over time a situation that contributes to the development of diabetic type 2. And please consult with your physician to learn more about how this combination happens. However, we have seen evidence that those who release their stress level and stay with a happier life, they have helped their diabetic type 2 to reduce, to have a lower A1C factor, and also eventually to be able to even resolve it for themselves. But of course, that requires so many other factors to consider and so many other things to overcome, such as lifestyle, eating habits, lifestyle change, and exercising, and of course, following the medication that, their physicians prescribes for them. But we know for sure that stress causes the loss of unnecessary cortisol, higher cortisol level, which is not good for body when there is no food intake, or in general to begin with. So now we're getting to the area of searching outside of the false self, right? And like I said, the false self is the selfhood that we develop as a result of the introjected messages from our caregivers, and we accept them as our own reality. right? Versus allowing our reality, which is our true self, to basically to grow, to flourish, to be recognized, to be accepted. And of course, this happens because we don't have the ability to do this and make these distinctions between false self and true self during our childhood. And then when we become adults, we don't have the necessary skills to basically make that separation on our own. And therefore, that's why therapy is needed. So I just got a notice that our next commercial break is on its way, and we will start with the searching outside of the false self right after our commercial break. And please call us at 951-922-3532. See you in a short few minutes. Thank you. Welcome back from our commercial break. This is Dr. Mitra and Dr. Robert at Heart-2-Heart program at KMET 1490 AM ABC News Radio. Dr. Robert, is taking a day off today, so I'm offering our program on codependency, the genesis of codependency today. And I'd like to invite you to please call us with your comments, questions. Our phone number here is 951-922-3532, and visit us at our YouTube. Okay, so we have been talking about the stages of codependency, and we reached the stage of 0 where we hit the rock bottom, and then we look for experience of recovery. If we feel that rock bottom, heaviness, if we feel that because there are people that they hit the rock bottom and they still don't understand that they can do self-initiation or develop motivation to go through recovery. And that's why, family members usually intervene, and they recommend to their loved ones to that, they need to go through recovery system, and they're wondering why, despite all the difficulties that their loved one is experiencing, they're not able to commit to recovery process. It's because maybe, maybe physically they are ill and they experience illness, but emotionally they haven't really felt the rock bottom process yet. So we have seen so many family members that as a result of this, they have suffered, and then we have seen caregivers becoming frustrated, or husbands have become frustrated as their spouses become frustrated at each other, because that hitting the rock bottom emotionally hasn't happened yet. And then sometimes people, when they get experience some serious physical illness, that will be a wake-up call for them, and they go after what's going on emotionally and mentally, and they go through that process. So for everybody, this is different. We can't say it's a one size fit all or one treatment fit all kind of a concept. Depends on how everybody, each person, experiences their life situation and how that rock bottom feels to them. So for somebody, it's very serious situation. For some people, even just witnessing, a situation is a good wake-up call for them. And I do have actually some of those, clients here. That one of them, for example, he was stopped as a result of speeding under the influence, and he even didn't recognize that he was speeding and he was under influence. He couldn't believe that he did that. But then again, when he had to go through the process of court, and his license was revoked. Thankfully, he didn't hit anybody, or he didn't hurt himself. But then again, that one incident was so powerful for him. That was his rock bottom, that he decided to put himself in a rehab and go through the process of therapy. And miraculously and thankfully, based on his motivation and his level of effort, he survived, and he's no longer drinking. He's been sober for about 2 years now since the incident, and he's diligently working on himself to the recovery of and in the discovery of his true, authentic, loving self, that's the whole game of, the aim of this program is for us to help you, the listeners, the viewer, to understand, that when you feel uncomfortable, there is something going on, and don't let just to hit the rock bottom so that you can have an eye-opening experience, but just go for it and then discover what's going on with you, because some of these hitting the rock bottom, they have no return situation, and then the damage can be permanent, and we don't want you to get caught in that. So so how do we basically search outside of the false self, right? Perhaps the common, denominator in this awakening is admitting powerlessness in some way, enough so that, we are able to seek answers outside of our false or codependent self, ego, adaptive or grandiose self. Yes, because when we believe that our defense mechanism are exactly what we need to do in order to survive, and that's based on our ego. So we say I'm right and everybody's wrong. I need to be in control, and I can and I am and I should control everybody. Otherwise, if I don't, I'm going to lose it. So during our, uh, we during this process, we become, as we have become attached to our false self, which, that false self convinced us that it was the only way that we could survive, right? That's the key part. We don't want to go beyond that. Once we realize that, that's where we need to initiate getting help and getting serious help. Having forgotten our true self and its connection to God, that's the spiritual part of us. We need that spirituality to help us to understand ourselves, right? We did not know that we were already and always safe and on the on an eternal journey and experience, a part of the divine mystery, and that is adventure. That was but a part of it. So it's very important to recognize that our ego, um, that feeling that we feel we know it all, uh, is all part of codependency, right? Why do we feel that way? Because we need something to keep us safe. So sense of control, sense of telling people what to do, sense of belief that you're the only one who can do this. You're the only one who needs to be everywhere and within the same hour, right? And attend to so many things. And if somebody disagree with you, you become so upset at them and you show anger towards them. All of these are a form of defense mechanism that Freud really, emphasized on them as a process of, feeling safe, and then the development of false self, and how a person can survive in this world. Recovery, begins at the moment we admit powerlessness and reach for help outside our false self. So why do we mean powerlessness? Because if we didn't feel powerless, we wouldn't come up with all these defense mechanisms. Isn't that interesting? If we were not feeling powerless, we wouldn't go after external factors to help us stay safe. We wouldn't go after drugs. We wouldn't go after drinking. We wouldn't go after other forms of addictions. We wouldn't feel unhappiness all the time. We wouldn't have gone to, do exceptional activities just to feel good about ourselves. Many people, in the process of addictions, one thing that is misunderstood is the difference between euphoria and happiness. And when people focus on momental kind of relief from the inner pain, and they use drugs, they use alcohol, they use gambling, they use sex, they use eating, and etc. Right? The, the feeling good of that moment, which is euphoria, is mistaken by happiness, which is constant, which is ultimate what we want, right? So none of those activities, those external activities, are going to give us the permanent happiness that we want to, because that happiness comes from inside of us. It's not an external factor. But external factors gives us euphoria, which is only lasts for the duration it lasts. And I do have clients that they use drugs, and when I their reason is that they like that momentum release and relief, and the good feeling that they have as a result of using or abusing. And then I explained the difference between euphoric as a result of external stimulation versus happiness that is an inner stimulation factor. And it takes them a long while to understand that. And the reason is because they have seldom felt it, or they have never felt it, right? So it's very important to understand how our false self can take over and makes us to believe that outside factors are what we need, for happiness. But then again, those are just the momentum happiness, momental ones, and they are not the source of ultimate happiness that we want. There are several, different possibilities that may occur to help trigger an awakening to our actual current conditions, and these triggers can occur to initiate any of the 3 stages of recovery. They may include experiencing any one or more of those awakening experience that we have. And then let me see if I can find some of those. For example, so yeah, let's see. Some of what we want, is what we want to see, in a healthy relationship when we are recovering, from addictions, is that we are able then to see love in everyone. To do that, we need to take responsibility for our suffering by looking within, ourselves, and that's one of the key factors that we go through recovery, right? And we can address and release our shame, guilt, hurt, anger, and resentment through the forgiveness process. So people ask, who am I forgiving? Well, to begin with, you need to forgive yourself for putting yourself through the process of codependency. And to do that, you need to acknowledge your true self, and to respect that, and to believe in that, and also to develop it, and to nourish it, and to bring it out by, and then of course you can't do that by yourself, and that's why therapy comes in. And then to believe that there is nothing lacking in ourselves, and that we are perfect child of God, and that our natural state is serenity. To respect our positive ego and use it as an assistant in our growth, right? And then so there are so many factors that we can learn about, and then when we go through the process of recovery, and each stages that I just mentioned, and there are so many others, these are the ones that we need help. Without help, we're not able to understand our false self, the way it is controlling our lives, and then how to understand and to bring out our own true self, and allow ourselves for the first time in our lives to function from the perspective of our true, authentic, loving self, the person that we actually are, the human being that we actually are. So when we get to a stage 1 of recovery, at this point, we need to reach out and ask for help. And if we find competent help and begin to take responsibility for our recovery, we may then begin a stage 1 partial or full recovery program. And then our stage 0 disorders and its pain and toxicity may begin to become less and less and less as we go through the stage 1, and take responsibility for how we are the one in adulthood that we desperately just stay connected with our falsehood, because when we are an adult, nobody's telling us to do that. But because we don't know any other way, we think that's the surviving way of life, and we stay with that. But then again, what about our happiness? And therefore, to take responsibility that I'm the one who's doing this to myself and nobody else. And therefore, going through the stage 1, the more and more we allow our true self to emerge, the less and less and less pain we experience, and some of our disorders actually can begin to diminish. So I just received a notice that our program is about to end, and I thank you for listening to us and giving us your Friday morning. On behalf of myself and Dr. Robert Jaffe, we appreciate being a part of our lives during this program, and we look forward to seeing you next Thursday at 3 p.m. for another episode of Human Sexuality and Relationship, as well as next Friday for another continuation of stage 1 recovery at 9 o'clock on Friday mornings. And until then, don't forget, all you need is love.